my name's Tara. I am with Ascension St. Vincent, and I have my counterpart Amy here as well. So we are a local healthcare system, mainly located out of Birmingham. So about Ascension. So most people know us locally as St. Vincent's Health System, but we are owned by Ascension. Ascension is the largest Catholic healthcare system in the country. We are a faith-based health system, and we deliver personalized, compassionate care to all with a focus to especially those that are most in need. So for fiscal year 2020, Ascension provided $2.4 billion in care of persons living in poverty and community benefit programs. So our mission is carried out through a number of subsidiaries dedicated to providing healthcare services to, again, those that are most in need. So our mission, vision, and values are the core of what we do. It is the basis of everything. So as part of our hiring, this is what we look for with those mission, vision, and values. And this is a lot of what attracts people to us as employers. So again, we are a Catholic healthcare ministry, so most of all of our care is dedicated around spirituality. Our values: service of the poor, reverence, integrity, wisdom, creativity, and dedication. So see yourself at Ascension. So you as a student are looking for the right organization to join to launch your career. You're a team player looking for the right team, because this is going to be your first work family, and you're someone who values work-life balance and also wants an employer that believes in that as well. So this is going to go over a couple of our locations. So our largest location is St. Vincent's, Birmingham. We are the oldest hospital founded in Birmingham in 1898. We have 400 plus beds, and we are known, most everybody knows this hospital as where babies come from. We are also the home of Andrews Sports Medicine. We have St. Vincent's East, which is located in Trussville. It's east of downtown Birmingham, about 10 to 15 minutes, 350 beds, and we are recognized for our ER, behavioral health, cardiology, and our bariatric surgery programs. And then we have as well, we have 4 other facilities. 3 of them, Blount, Chilton, and St. Clair, are known as our rural facilities. They're smaller 40-bed hospitals. And we have St. Vincent's 119, which is off Highway 280. It is more of a wellness center. So when you see yourself at Ascension, some things to consider. So associate benefits, we have really great benefits, tuition reimbursement as well, medical, dental, vision, and part of our program is a wellness program. So we encourage you to go to the doctor and make sure you're getting those yearly checkups. We have free parking as well. That is something to consider at all of our locations. Learning and advancement, if you want to come in, whether you're a nurse or in another professional position, we do have different opportunities to grow and allow you to work your way up. And then our culture is a big part as well. So we have a culture of teamwork, flexible scheduling. Some departments offer self-scheduling. And then, of course, spirituality in the workplace. You will see, whether you're on a nursing floor, you may see a doctor that is praying with a patient, or a nurse that is taking that extra time to pray with a patient. And then lastly, I put our contact information on here as well. You could reach out to Amy or myself with any questions that you have. We would love to speak with you.
It's funny you said that because we were just talking about this last week about skills of newly hired employees of what we look for, and we're so diverse in our culture here that you would be surprised at the different kinds of skill levels that everybody bring. But I would, as a talent advisor, I would love to see outside of our classroom skills is dedication to the workplace. I mean, somebody that wants to come in and be there on time and bring in a motivation of teamwork, those types of skills outside of the classroom. I would love to see that.
I would say nursing, honestly. Our nursing and our clinical staff for us, we just, of course, with everything that's been going on as far as COVID goes, nursing and clinical staff, there is such a need for those right now. So we have seen a lot of growth, and we've seen a lot of students, nursing students and healthcare students that really want to help and want to be there to take care of patients. So that, I would say, that's where I've seen our most growth is nursing assistants, patient care techs, and nurses.
For our staff, as far as like our healthcare employees, is that what you're talking about? Mm-hmm. We have had to close a lot of our floors and open up for COVID. So a lot of our nurses have had to actually become COVID nurses, so to speak. A lot of our employees have been moved to remote workers. We have a lot of our support staff that have gone home and working from home. That's about Tara.
I would agree. Yeah, I would agree. One thing that I've seen as far as staffing go is just really the flexibility of our team. We have a culture at our hospitals that we want our nursing staff and all of our associates to have the flexibility and be willing to jump in and, hey, what needs to be done to get this teamwork done. And I think with COVID, that brought so much unknown. And like Amy mentioned, a lot of our staff went to work from home, and that's a big adjustment. And, just the nurses and the nursing support having to, okay, well, I'm not going to be on my home floor anymore. I'm going to be somewhere else. How do I adapt to that change and be flexible with that?
Yeah. And a lot of our associates have actually met new friends because you work in a certain area, you don't really get to see, other people. So having to move to other floors, it's amazing the relationships that have been built because of COVID within our hospital staff.